Hi, I'm Dr. Craig Spodak, and today I'd like to talk about headache. Many patients and people suffer from headache, and we don't know a whole lot about why and what we can do to help them. Of course, we all know that there's many drugs that are out there to help a person feel better, you know, Advil, and for the more serious migraine sufferers, Imitrex and the like. But we don't really get down to the root cause of headache because we don't know a whole lot about it. One thing we do know, though, is that clenching your teeth can be a root cause of headache. Many patients and people don't know that they clench their teeth, and the reason why is because they only do it in the deepest form of their sleep. Sleep is an interesting thing on its own right because we know very little about, the nature of sleep and what we do while we're sleeping, or even the purpose for sleep. We do know, however, that sleep is characterized by a period of very low body activity. When you're sleeping, you're not really moving around too much, but very high brain activity. For certain people, when they go into the deepest form of REM sleep, they start clenching their teeth. We don't know why, and we don't know too much about how to help them do that. But normally, when a person functions, their teeth only come together for a very few moments of the whole day. Even when you're eating, your teeth almost touch, but they don't. You don't sit next to people and hear them eating like this. It doesn't happen. People are almost getting together with their teeth, but they're not fully coming together. But in certain individuals, their teeth, as soon as they get into REM sleep, they're really clenching and growing the whole night. Their teeth are locked for maybe 4, 5, 6 hours of the whole night. And those patients, when they wake up, they feel really sore. Their jaws are sore, their temporalis muscles sore, their masseter sore. Some of them even get neck pain because part of these neck muscles are contracted when you're biting really hard. For those patients, we found a significant increase in the patients that grind and their incidence of migraine headache. And a long time ago, in the 1950s, they started using these devices. About 10 years ago, a device was pioneered called the NTI appliance. It's actually a very small piece of plastic. What this device does is that when you wear it, it blocks the ability for people to clench and contract their temporalis muscle. And over time, people find that they grind less and their headache incidence goes down. The FDA, the Food and Drug Administration, actually approved this device for the treatment of migraine headache. So that's a pretty big deal. The FDA doesn't grant these approvals lightly. So the nice part about this, there's no surgery, there's no medication, there's no shots, there's no pills. It's just simply a small piece of plastic. Cost-wise as well, you'll find yourself spending a lot less for a device like this than you would over a lifetime of medication. And in our practice, in my hands, it's worked really, really well for us. It's been a godsend to many of my patients. So I'd like to go over a little bit about the device. When you clench your teeth together and you put your fingers on your head, you can actually feel your temporalis contracting. Imagine if you're doing that 4 or 5 hours in the middle of the night sleeping. You're going to wake up with some soreness. The migraine sufferers oftentimes say, geez, they feel like their head's in a vice grip because their temporalis is so sore from that whole hours of clenching. Imagine if you went to sleep and all night long you were moving your shoulder in an erratic fashion. You'd wake up and your shoulder would be really out of alignment. You'd feel a lot of soreness there. It's the same principle with the jaw. When you actually put this device in your mouth, and you try to attempt to clench, you cannot fire these muscles. So it's a test for those that viewing this video from home. Go ahead and put 2 fingers on your temporalis muscle right here where your temples are, and clench your teeth. You'll feel your temporalis, contracting. Take your left hand, your right hand, and just put your thumb in between your 2 front teeth, and try and get your temporalis to contract. You can't, and that's the same principle behind this device. The other thing is it conditions you. So as you wear this device, you start to grind less and the headache incidence and severity go down. Like I said, it's been a godsend to our patients, to many of our patients. Headache's a very, very big condition and there's a lot we don't know. So to guarantee a device like this would work for everybody would be ludicrous. But when we're treating this monster disease, this is a great and effective tool that you may be a candidate for. If you want to find out more about this device, you can go to headachehope.com or Google NTI and you'll find a whole bunch of links about it. If you live locally or you're in the South Florida area, please call my office. and we're more than happy to schedule a no-charge complimentary consult for you. We could talk about your headache symptoms and see if a device like this is a worthy investment for you to attempt to rid yourself of headaches and live a better life. So once again, thanks for listening to the video, and I'm Dr. Craig Spodak of the Spodak Dental Group, and we look forward to seeing you here. Thank you.